Thanks. Danny McGuigan to be followed by George Irving.
Thank you very much, Mr. Deputy Presiding Officer. My name is Dr. Danny McGuigan, and I've been delivering training and development and mentoring and coaching and stress auditing services to the NHS in Scotland for over 10 years. How should the NHS in Scotland be reshaped to better meet patient needs? I was interested to hear Professor Sir Richard John Temple mention well-trained professionals, and I would add, well-trained managers and leaders. He mentioned challenging and fulfilling roles, and especially younger people leaving Scotland. I was delighted to hear Richard Norris speak about trust and good faith, because what I would like to say here today in this House is that the NHS in Scotland should be a great place to work. It should be a great place to work because friendships and high performance make it a great place to work. In my experience, for some, perhaps for many, the NHS in Scotland isn't a great place to work because staff feel exhausted, demotivated, de-energised. They feel that way, they tell me, because they're unhappy, first of all, with the prevailing culture and with media negativity. What does culture mean? Well, the most widely accepted definition of culture is the way we do things around here. And to be quite honest, I can't really make any sense or pattern to the way the NHS in Scotland does things. It seems to be quite incoherent. I've identified a number of problems, and you may find them quite strange. They're uncomplicated, but they're daunting. Namely, the outdated and misleading definitions and understandings of what it means to be a professional, to be a leader, and to be a manager. They're archaic, they're outdated, and they need to change. I believe that those bureaucratic and outdated and archaic ways of managing and leading squeeze out, discourage friendship at work, and that's my principal interest. I've come across attitudes, decision-making processes, and behaviour in the NHS in Scotland which add up to and point to unhealthy culture. In one study I took in one division of the NHS, staff described to me the way in which they experienced the culture as follows. Disciplining friends is too difficult, so don't make friends at work. Make acquaintances. Friendship gets in the way of decision-making. Do as I say. Friendship and feelings have no place in the NHS. And in any case, you're here to work, not make friends. In that organisation, I discovered that 19 members of staff, 19 members of staff needed immediate help for stress-related reasons. The chief executive responded immediately with a culture change programme. In the midst of that culture change programme, members of staff were encouraged to communicate and effectively develop relationships that had previously been denied them. When asked, and after 2 years, a further audit discovered that no members of staff needed support, professional support. When asked what made the difference, staff reported freedom to make friendships, freedom to make friends at work openly and nourish those friendships. They reported that trust was blossoming, conflict was being navigated in a more robust and speedier manner. In short, leaders and managers modernised themselves and the staff followed their example. The European Commission's Network for Workplace Health Promotion has just published one of my articles on their internet site entitled "The Power of Friendship and Leadership for Well-being and Work-Life Balance." So our European partners are well disposed to this concept of friendship for health and high performance. They're promoting it. I put it to you that the top leaders in the NHS today need to find a way of determining a leadership style, a management style that respects the power of friendship for well-being and high performance at work. I believe this will carry moral authority, will energise staff to willingly take on even more responsibility. I appeal to all of you, and especially to Mr Kevin Woods, the new Chief Executive of the NHS in Scotland, to take a serious look at this proposition. You may be wondering, how can all of this be done? That would take at least another 4-minute intervention. Thank you very much.